Thank you, Mr. Speaker, and I thank the gentleman. As a mother, a breast cancer survivor, and proud Floridian, I rise today in opposition, in strong opposition, to the majority's irresponsible efforts to repeal the Affordable Care Act, because the facts speak for themselves. 20 million Americans, including more than 1.5 million Floridians, have obtained quality, affordable health care since the ACA became law. 129 million Americans who, like me, have a pre-existing condition can no longer be disenfranchised by their health insurance company. Our nation's young adults now rest easy that they can stay on their parents' insurance until they're 26. Allow me to remind my colleagues on the other side of the aisle that we were elected to help Americans, not hurt Americans. And make no mistake, repealing the ACA will not only rip health care away from millions of Americans who have Obamacare, but we owe it to the 155 million Americans with employer-based coverage to maintain the prohibition against annual and lifetime limits. Before the ACA, 105 million Americans, most of them with employer coverage, had a lifetime limit on their insurance policy. The ACA prohibits annual and lifetime limits on policies. We owe it to our seniors to stop the repeal of key new Medicare benefits. Repeal of these life-saving provisions would actually increase prescription drug costs for millions of seniors in the donut hole who are currently saving more than $2,000 on their drugs due to the ACA by reopening the gap in Medicare Part D coverage. In addition, since the enactment of the ACA, the solvency of the Medicare Trust Fund has been extended by 11 years. And we owe it to the 129 million Americans like me with pre-existing conditions, like breast cancer survivors, to stop repeal so they cannot be dropped or denied coverage or charged an exorbitant premium by their insurance company. As a cancer survivor, I am also appalled that the Republican plan, or lack of a plan, would increase out-of-pocket costs for every patient by requiring them once again to pay for preventative services like cancer screenings. Mr. Speaker, the assault on the well-being of our constituents is an outrage, and we will not take it lying down. We will fight tooth and nail for the established right of all Americans to have quality, affordable health care coverage and not return to the days when it was available only as a privilege to those who could afford it or who were fortunate enough not to have a pre-existing condition. Thank you. I yield back the balance of my time.
Gentleman's time has expired.